One of the important topic for the all community worker, it is the school student or school health. This is lecture 3. This is lecture 3 of your curriculum, which is talk about the school health. By definition, what we mean by the school health? School health refer to the state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease or infirmity among pupils, teachers, and other school personnel. This is mean the school health, it is one of the health care. This is care contain physical. What we mean by the physical, there is the healthy body, health function of the body, health appearance of the human being, and the mental health. Mental health means that the human being have no mental health problem like mental diseases as schizophrenia or obsessive compulsive disease. This is a type of the mental illnesses or psychiatric illnesses. Social well-being, the community which that individual living. Community which is that individual living. They have able to face, they have able to easy to contact with the other personnel in their community. They they have the same language. They have easy to contact with them in any field of the care. Spiritual means that the human being feel, the human being internal feel. This is spiritual well-being. When we call the school health, means that the pupils and هم students at the school, the teacher and other school personnel like worker, like a seller, like service personnel, all these personnel within the school must have a complete physical, mental, social, and spiritual well-being. Not we mean that the absence of the disease or infirmity. Infirmity mean disability. That person cannot do their life as any person within their age and sex. What are the health school services? What are the health school services? Health school services, ideal school health services refer to need-based comprehensive services rendered to the pupils, teacher, and other personnel in the school to promote and protect their health. But practically, it is referred to providing need-based comprehensive services to the pupils, promote, protect their health, control disease, and maintain their health. When we call school health services, we mean that this care or these services must be complete to meet all need of the student or their teacher or the any personnel at the school. This need can be like promote. This is the personnel at the school need health promotion regarding problem at their school. For example, there is a lack of water, safe water, there is a bad sanitation, there is a poor school classes environment. All these called needs for the human personnel in the school. When we call school services, we mean that we must meet this need and try to solve this problem can face the student and their teacher in the school. This is which is called by the school health services. Objective of the school health services. There are the many objectives for the school health services. These services can include the promotion of the positive health. What we mean by the positive health? The promotion of the positive health. The promotion of the health promotion, we mean that we are tend to improve their health without individual suffering from any diseases. For example, advise the person to adopt exercise, to take a healthy food, to recreate for him, to save their mental health or their social relation. This is one we call by the promotion. Promotion, we mean that they improve their life to the positive health. We mean that if there is youth, we advise them to avoid smoking, to adopt exercise, to avoid drinking, to avoid to adopt a bad habit. That means we promote them to positive health. Also, the other objective of the school health is to prevent a disease. There is many diseases can spread in the school, like a communicable disease, like food poisoning. Okay, sorry, this is not a communicable diseases, but it consider one of them because germ or organism can taken by the student and lead to the disease. Okay, or waterborne diseases. Okay, there is like pinworm, infection of the pinworm. Okay, this is can transmitted from the student to student because they are share their eating together. Okay, disease can be transmitted through all the school. Okay, we go to prevent this disease which can transmit through the students in the school. The third objective is to early diagnosis, treatment, and follow up of defects. Early diagnosis, treatment, and follow up of the defect. Early diagnosis, that means the student worker or the health worker in the school or the teacher must diagnose early any problems that can arise in the school. For example, the student may complain of the dental caries. Some students go to come to you and say to you there is a black color in my teeth. This is called dental caries. If you are not diagnosed and go to treatment this and follow it, this is can lead to destruction of the teeth. And there is a many problem lead to related to the destruction of these teeth. The fourth objective of the school services are a working health consciousness in the children. A working health consciousness in the children. The health education is be better and can be good adopted by the children. If you go to any community and advise the community about the health problem, you find that the children may take the message strongly and go to advise their mother, and go to advise their teacher, their brothers, any personnel at their home. The student or the children can be a good transferer for the message. For this reason, we go to the school. The one objective of them is to improve or to help the student to adopt a healthy practice in their life. This can be very successful in the school. The fourth or the fifth objective, the provision of the healthful environment. School have many physical environment. There is a need for good lighting. There is a need for adequate heating or suitable heating. There is a need for good ventilation. There is a need for good water supply or safe water supply. There is a need for clean air. This is all component of the environmental health, of the environment of physical health. In the school, the worker in the school or the health carer of the school must be sure about safe environment. For example, in the classroom, you must be sure that there is a good ventilation, because there is many diseases and many infections can transmit due to poor ventilation. You must be sure that the ventilation it be adopted well, or it be well for every student in the class. The last objective of the school health services is rehabilitation of the handicapped, that's disabled person and need help for doing their daily activity. Rehabilitation means that help those handicapped to adopt their life normally, with help. In the school, those a mental retarded, slight mental retarded children, or a Down syndrome children, or a hyperactive children, all those called the handicap, because they are not live normally, they are not do their activity normally as their other students. Those all need a help to be practiced or to be learned well at the school. The other slide, we want to talk about the principle of the school health services. What are base of the school health services? Type 1. Be based on the health need of the school children. When we work at school, you must determine the need of the school health of the school which you work in it, not from your study, not from your concern, in real situation in your school which you work in it. Okay? The other principle of the school services, health services, be planned in the coordination with the school health personnel, partner, and community people. The community worker or the school health worker, health care in the school must not be working alone. She need help. If you want to save the environment, if you want to help students, if you want to prevent a disease, you need many other persons with you to help you to control this practice or to control this disease. For example, parent. You need a parent. You need community people, which is a school in it, within the school. Community people within the school. All health personnel, a doctor, nurses, lab technician. All these kinds, can help you to prevent or to save a health of the students. The other principle is be part of the community health services. Yes, community health services. It is a broad branch of the community care. One of those branches, important, very, very important branches, is the school health. The other principle emphasize on the primitive and preventive aspect. This is mean that your focus when you work in the school, you must focus your activity in to شنو to prevent aspect انه to prevent disease from the spread, to determine the problem which can be preventable. Okay, the other principle is to emphasize on the health education to promote, protect, improve and staff. Yes, one important component of the school health is the health education. Health education can serve in many aspects of the health, like health promotion, health protection, disease prevention. Any health personnel at school must emphasize on the health education. Emphasize on learning through active and desirable participation. This is mean the learner must be active and have interest to practice in their solving their problem. Okay, this is mean a student or teacher or school personnel to participate to solve their problem, or any problem can arise in the school. Be ongoing and continuous program. This is program cannot be for a one time, it's be a continuous program. Have an active system and record keeping in the reporting. Documentation. Any health personnel must document, must report, must put an idea, and this must be written and saved in the record of the school. This is help to give idea or to give secondary data for the show for the second personnel work in the school. طيب, there is the school problem as like what? There are many school problem. This is can be health problem or behavioral problem. The problem can be health problem or behavioral problem. طيب, let us start with the health problem. Health problem can be malnutrition. There is a many diseases of malnutrition. Okay, vitamin A deficiency, one of the malnutrition. Anemia, one of the malnutrition, one disease of the malnutrition. Marasmus, one disease of the malnutrition. This is child in this picture can give idea about the appearance of the malnutrition. This child be under the weight. Okay, اللي هو you see the ribs, you see their bone كويس, and also you see that is if you see in your eyes you think that is must have anemia, she have anemia or she has anemia كويس. This is clean from the picture. This is one for health problem you can find in the school health. Infectious diseases, common cold, as we famous as this day is corona, worm infection, diarrheal diseases. This can be transmitted through the pupils or the students. في intestinal parasites. This is like the worm, as I told. Disease of the skin, eye, and ear. There is many diseases can transmit it, like fungal infection, like a fungal infection, which you can see in the school. الفنجل infection like الجوبة. بالجوبة نحن بنسميها بالعربي شنو؟ الجوبة. ولا كمان شنو؟ ولا it can be coronary disease which is called trachoma. Trachoma, it is an eye infection, can transmit from student to the another. And otitis media also can be transferred if the student use a pen in their ear, can transmit this disease from student to other. في other diseases, it can be a dental caries. One of the oral problems that can face the students.